Welcome back to the Dr. R Show. We're here again with urologist Dr. Geoffrey Nuss. Welcome back, Doctor.
Thank you.
Now it's time to talk about big prostates, better known as BPH, which stands for benign prostatic hyperplasia. Dr. Nuss, what is BPH?
As the term implies, it's an enlargement of the prostate due to a benign or normal physiologic growth of the inner portion of the prostate.
And why does the prostate enlarge like that? What causes that growth?
The main cause is, number one cause is age. As men age, we are going to get bigger prostates. That's a fact of life. That's how God made us. The main cause of that is exposure to androgens or testosterone. Over time, the prostate gland uses that as basically food and grows.
And when does BPH begin, and how common is it?
It's extremely, well, I'm sorry, to back up, answer your first question. It begins at around age 40, and as men get to that age, their prostates will start to enlarge. And it's probably going on for a lot longer than that, but it would become more common to be symptomatic after age 40, and then at age 50, 60, 70, it's very common to be symptomatic.
So it begins at age 40. Is it occurring really soon after we hit puberty and our testosterone levels increase, and then?
There is a certain amount of growth that happens, but certainly not anything that would become symptomatic before 40 to 50.
And how large is a normal prostate?
A normal prostate would be about the size of a walnut, and it can get as big as a grapefruit.
How long would it take to get that big?
Some men, not very long. So I've seen 50-year-olds with prostates the size of an orange, and they're just genetic factors.
And so if you have a prostate the size of a grapefruit, you can still walk and sit and ride a bike. And yeah. I would imagine that'd be hard to do.
Well, that might be a little bit of an exaggeration, but typically, because it's located deep within the pelvis, there's no external symptoms or pressure that you feel. The main symptom of benign prostatic enlargement would be urinary symptoms.
Any increased risk of cancer with such a big prostate?
No, that's a good question. Prostate cancer has a totally separate risk profile, and BPH, some men will come to me and ask, well, my prostate's enlarged, what can I do to shrink it so I don't have any risk of cancer? And I tell them prostate enlargement happens on the inside of the prostate. Prostate cancer typically happens on the outside of the prostate. Two separate places, two separate processes.
Is it different cells?
Different cells. Both cells can cause cancer, but due to some intricacies in the anatomy and cell signaling, the inner portion of the prostate, or the transition zone as it's known, is the portion that gets enlarged and causes symptoms and is typically benign. That's not the case all the time, but typically is benign.
Now, is the tissue different in the transition zone than the zones around it?
It is. The transition zone is what we call the adenomatous tissue. So the adenomatous tissue is the benign growth, and that is what the zone that is predisposed to abnormal growth that causes symptoms when exposed to androgens over time.
So the cells around that central portion of the prostate are different than adenomatous, or a different type of cell?
They're all the same kind of cells within the prostate. They're located differently, and so they can become symptomatic. A man can become symptomatic from that much easier.
So, and now what are the symptoms of prostate enlargement?
That's a great question. The symptoms of prostate enlargement include, most are urinary, and so they include a weak urinary stream, noticing that when you're at the baseball game and you stand next to your neighbor, it takes you a lot longer to finish urinating than your neighbor. Other symptoms include having to go to the bathroom frequently, having the urge to go and not being able to make it to the bathroom on time. Those are some of the classic symptoms.
So now, if you have the urge to go and you can't make it on time, that means you're urinating prematurely. Why is that happening? If it's an obstruction to the urethra, you would think that you'd be delayed, not the other way around.
That's a great question. So there is a complex interaction between the prostate and the bladder. The prostate is a gland that sits right below the bladder, and when the prostate starts to obstruct the outflow of urine coming from the bladder, it can induce changes in the lining and the muscle of the bladder, which can signal to your brain that you have to go to the bathroom frequently and you have to go now, which is like urgency. And so that complex interaction is what causes this constellation of symptoms.
And how do you diagnose BPH? Is there a test that's performed? Is there any x-rays, diagnostic tests, or is it a clinical diagnosis?
For the most part, BPH is a clinical diagnosis. Perform a examination performed by a urologist or a primary care physician with a rectal exam, which is feeling the back of the prostate through the rectal wall. Also, the things that would need to be performed is a urinalysis and, more controversially, a PSA.
Now, can you have BPH and normal prostate on exam?
You can't. That's a great question. So symptoms do not always correlate with prostate size. Many men come to me and say my doctor's told me for years that my prostate is enlarged. And I feel their prostate, and it's very normal for their age. But they still have bad symptoms, and so we confuse those two terms. So small prostate does not always equal no symptoms. And so that's something we are still doing research on, what causes some men with small prostates to have more symptoms than others.
So in men with small prostates, they're just getting overgrowth of tissue around the urethra, and outside everything feels normal.
It's possible, but it could also be possible that they have a primary bladder process, like overactive bladder. I'm sure you've seen the commercials for many of the medicines on TV. That's a common condition in men and may mimic or be similar to BPH symptoms. And so having those kinds of symptoms, any man should seek help either with his primary care physician or a urologist to figure out whether this is a bladder or a prostate problem.
And so how do you treat BPH?
The primary treatment of BPH would be medical therapy. There are many good medicines out on the market now that are very good. However, some men do require surgery. There are different surgical techniques that can remove the prostate, ranging from directed microwave therapy to directed laser therapy. And it's a very exciting part of urology, and I enjoy taking care of patients because it makes a big difference in their lives.
Great information, Doctor, and thank you for being on the show. And thank you for tuning in today. I hope you've learned something that you can use to improve your health and perhaps even lengthen your life. Please tune in next week for another Dr. R Show, and until next time, healthy living and goodbye.